Dream Team, it's your boy Neal, back with another reaction video, guys. Here we are with why Germany's healthcare system is in crisis and how the government plans to fix it. I'm intrigued to hear about this because I know that Germany has great universal healthcare for its citizens, and I've heard a lot of good things about German healthcare in a lot of different videos. But before we jump into this, make sure you subscribe to the channel, ring notification bell, get a video a thumbs up so it gets suggested. If you guys got a favorite video suggestion, you can subscribe to Patreon or drop it in the comment section. What we got?
A wave of viral infections has pushed Germany's children's hospitals to their limit. This winter, doctors' practices and children's hospitals were bursting at the seams. Some clinics didn't even have beds available at peak times.
Die Situation ist so prekär, dass man wirklich sagen muss, Kinder sterben, weil wir sie nicht mehr versorgen können.
There is also a shortage of antibiotics, painkillers and medication to reduce fevers. Production was outsourced to other countries to save money, at the cost of reliability. The chairman of Germany's Hospital Association said, "Right now we are seeing all areas of healthcare being pushed to their limits."
How is this possible in a country that spends more on healthcare than almost any other country in the world? More than €1 billion a day.
So, what went wrong?
That's what I said. How are you having a shortage? If you're spending that much money on healthcare a day, like how do you have like a shortage of these things that are needed? And now you have all these children getting sick and there's not enough medicine. Yeah, what's going on?
More than €1 billion a day.
So, what went wrong? Even though children's hospitals are currently in the spotlight, Germany's whole health system is affected.
One major problem, there are colossal staff shortages.
Hospitals like Berlin's Charité had to cancel scheduled operations. Only emergency procedures were carried out.
Dass wir diese Belastung ja im letzten Jahr auch schon hatten in dieser Form. Und durch die ganze Pandemie hat ja viele Menschen auch daran zweifeln lassen, ob die Arbeit im Gesundheitssystem für sie noch die richtige ist. Und deswegen ist es eben leider auch so, dass viele Pflegekräfte nicht 30 oder 40 Jahre im Beruf sind, sondern oft schon nach 8 bis 9 Jahren den Beruf verlassen.
During the pandemic, thousands of nurses quit their jobs. For the remaining staff, the situation is increasingly difficult, especially during the winter virus wave.
Wir haben die höchsten Krankenstände, die wir je verzeichnet haben. Und die Kolleginnen, die noch da sind, die schaffen nicht mal mehr das Nötigste.
But the current virus wave is just the straw that broke the camel's back.
Thousands of nurses quit their jobs. Like, that would definitely cripple healthcare 100%. And then they said so many nurses getting sick now. Like, this is crazy. And what virus wave is going on?
But the current virus wave is just the straw that broke the camel's back. The underlying problem is more fundamental. And spoiler, it's about money.
How are hospitals financed in Germany?
Up until around 20 years ago, hospitals were paid per patient per day. As a consequence, they could make more money by allowing patients to stay longer. To make the system more efficient, the so-called DRG system was introduced, short for diagnosis-related groups. From that point on, hospitals were paid per diagnosis, no matter how complicated the treatment was. An incentive to treat patients quickly, efficiently and en masse.
Certain procedures, like knee surgery, became more financially attractive and were performed more often, even if they were not always necessary. Losers under the new system, time-consuming specialist areas like pediatrics and care. But wait, there are more problems.
Yeah, I don't, why would they make it like that to where they do it by diagnosis to where now, like, hospitals are performing surgeries that people don't necessarily need the surgery, but if they perform the surgery, then the hospital gets more money from the government. And I don't know, that seems kind of awkward to me.
But wait, there are more problems.
Since the introduction of DRGs, Germany's health system has become more focused on economics than on health. More and more hospitals, by now nearly 40%, are run by private companies. and their
Wow.
goal is to make money.
Of course.
Many doctors and nurses are frustrated by the working conditions. Overtime is common. Often there is not time to take a short break or even go to the bathroom.
Es wird jeden Tag verlangt, dass wir unter unserem beruflichen Ethos arbeiten. Und das macht die Leute mürbe.
Ärztinnen und Ärzte brennen üblicherweise für ihren Beruf. Aber wenn sie durch so hohe Überlastung beheizt werden, dann ziehen sie irgendwann auch mal Konsequenzen.
Every fourth doctor in Germany is considering quitting their job. By 2035, more than a third of all healthcare positions could be vacant, a study found. Many
No
are
way.
particularly frustrated about the high level of bureaucracy and a lack of digitalization. Nursing staff suffer from a lack of recognition, responsibility and low pay, and there aren't enough staff to plug the gap. And the gap is getting wider.
Are you
Wir können
serious?
seit vielen Jahren schon unseren ärztlichen Personalbedarf nur deswegen decken, weil Ärztinnen und Ärzte aus dem Ausland zu uns kommen und bei uns arbeiten. Sonst ging es schon lange nicht mehr. Denn wir bilden deutlich unter Bedarf aus. Die Anzahl an Medizinstudienplätzen in Deutschland ist zu gering.
But what's the
Really?
special problem with children's hospitals?
Bro, this is wild hearing this, bro. Like, cause it seemed like, yeah, like that, like she said, that gaps keep widening. She said by 2035, a third of all, like, staff in these hospitals, positions could be vacant, could be gone, because people are, and when you do, like, give someone a heavy workload, when you do overburden them, of course, burnout is gonna happen. No matter how passionate you are, no matter how excited you are, like, if you're constantly being overworked, burnout happens. Especially here in America, where profit is always the top priority, happens all the time. And so you can understand why doctors or nurses would be wanting to leave or ready to leave or actually leaving their jobs, because you have to deal with it. I mean, it's already a high stress job, and then especially for the nurses, when you're getting underpaid, when you have to perform all these things that you have to do, and then there's so many nurses that are quitting now, and so you have much more responsibilities. It's just stressful.
First, pediatrics takes more time, and that means money.
Kinder und Jugendliche und auch ihre Eltern haben natürlich einen ganz anderen Betreuungsaufwand. Sie müssen altersentsprechend mit den Kindern und Jugendlichen umgehen. Das dauert auch viel, viel länger, als wenn sie einen Erwachsenen vor sich haben.
The same level of specialists are needed in pediatric and adult care alike. But children's doctors treat less patients and aren't paid for being on call.
Waves of infection that keep pediatric staff busy are more common in winter, meaning that during summertime they have less to do, but still need to be paid.
Deswegen wird es notwendig sein, hier ein anderes Finanzierungssystem für die Pädiatrie zu
For
haben.
sure.
So, what is to change? To address the financial difficulties in the whole system, Germany's health minister Karl Lauterbach has announced what he calls a revolution in hospital care. He says he wants to put medicine first rather than economics.
Okay.
Payments per
I like
diagnosis
that.
are to be reduced. Instead, hospitals are to receive money for overhead costs, like staff and equipment.
Thank you.
To operate more efficiently, hospitals will be arranged in 3 tiers, from hospitals providing basic care to highly specialized hospitals.
Costly overnights are to be cut down by performing more procedures on an outpatient basis.
With these measures, the minister hopes to use money and manpower more efficiently and thereby relieve the whole system.
And for the particularly affected pediatric care sector, a 300 million euro aid package is planned.
Critics fear that the reforms won't solve the staff shortages and that the issues relating to payments per diagnosis will still persist. So maybe this is not the envisaged major overhaul of the system, but a desperately needed new start.
Yeah. I mean, I feel like you have to switch it up. Like, even if it doesn't end up working, if you had went with the system that you have been going with for, you know what I'm saying? That's already failing, and obviously in the future it was gonna fail as time went on. So they definitely switched it up. I like the idea of hospitals, basic care, specialized care in different tiers, and I like the idea of paying staff paying hospitals for like overhead and equipment and all the stuff that they need. But I mean, yeah, the shortages. You're probably gonna have to pay the staff more. Is what I assume, and I mean, I guess that would be the only way to help with the stress, because I mean now, like, you're able to hire more people because it's more money, and so now all these people aren't burdened with literally all this responsibility because they're short staffed. And now they can take breaks. They can and take some time off. But when it comes to all of those decisions, that is way out of my area of expertise. So I hope it works. I'll say that. That's all we got. You guys got a favorite video suggestion, you can subscribe to Patreon or drop it in the comment section. Subscribe to the channel, ring notification bell, get a video a thumbs up so it gets suggested. Social media, Patreon, all up top. Subscribe to any of that. Put all the links in the description. All you gotta do is hit the link, follow me, talk to me. Love talking to you guys. You guys are the most incredible team on YouTube. It's your boy Neal. Out.